Thanks, Melanie, and thanks for setting this up. When we were planning for Program Center Stage, we thought this was perfect timing to really talk about some major health initiatives and some major changes that are happening and things that are in place. And so today's agenda, we're going to feature talking about now all of a sudden my slides won't move. There we go. We are pleased to have everybody introduce themselves if you haven't already in chat, so we get to know who is with us and we can follow up as needed. And also we have with us Adam Hughes, who's going to, as Melanie mentioned, is the health manager position, and to provide an overall framework of where he sees things going with the strategic framework for health and well-being and his role in that and what that looks like. And then we're going to talk a little bit about one of those initiatives within that health framework, which is Excite, a little bit about the purpose and history, and especially about where we're going next as we make a major shift in the Excite programming, and want to make sure that the system is aware of the shift and change that we are making at this point and your opportunities to be involved. So that's what we hope to accomplish, and have you walk away feeling where you might have opportunities to engage in all of this work and be informed as we go about doing those things. So I'm going to turn things over at this point to Adam, and Adam, take it away and provide this overall perspective in your role as the program manager. Thanks for being here.
All right. Thanks, Michelle. And hello, everybody. I hope all your weeks are off to a great start. So thanks for inviting me. I did want to take a few minutes and take the opportunity to share a little bit about the vision as I inherit this role and take this role on over the next year plus. You can hit the next slide. So, and I'll quickly, and for those of you who don't know me, my name is Adam Hughes. I am at Cornell Cooperative Extension. I am a state extension specialist. So I have, over the last 8 years, worked with 14 county associations. So we are decentralized in New York State. We have 56 county associations. I had oversight support of 14 of them. As I came into the role, because of my background in public health, I started with doing some opioid prevention work because I actually have a background specifically in opioid prevention. And this was back in 2018 when the USDA was one of the 18 federal agencies mandated in the opioid response. Then COVID happened, and my background in public health continued to sort of intersect with the work that we were doing. Cooperative, as all of you know, Cooperative Extension has been doing public health work since its inception. And we've been moving more and more to become explicit public health partners. So I've been doing the statewide public health leadership along with overseeing some county associations. And I'm just now, as I've taken on this national role formerly held by Roger Renkamp, I am moving away from my county work, doing the public health work for CCE and doing the public health work in this role. And as I came into this role, one of the things that I talked with Extension Foundation and ECOP about was, what does the next year plus look like? And really what I wanted to emphasize was acknowledging and appreciating all the work that was done prior to me coming into this role. And that includes the work of Roger Renkamp and of Michelle and of Excite and the creation of the 2021 National Framework for Health Equity and Well-Being. And one of the key priorities is revisiting that framework. As public health priorities evolve, we want to be attuned, and we want the framework to be that sort of foundation that anybody across all the LGUs can pick up, and no matter where they are on the health continuum related to programming, that they're able to utilize the framework to help build capacity and develop this type of work in their system. So revisiting that 2021 framework is one of the priorities that I am really focused on. I have been reaching out to the institutional contact listserv. Some of you on this call may be the health and well-being institutional contact. And to the next bullet, one of the ways another priority of mine coming into the role is enhancing communication, the mechanisms that Roger created while he was in the role, including the institutional contacts. And as we moved into updating the 2021 national framework, once we got the sort of stamp of approval from both ECOP and Extension Foundation, I reached out to both the Health Leadership Committee, which is a group that I oversee and lead and support, as well as the institutional contacts, and basically said, whether you were part of the 2021 process or not, we welcome the opportunity for you to tell us what level of role you'd like to have in the next iteration of developing the health and well-being framework. And so the communication mechanisms are all being revisited, which includes the institutional contacts, the Health Leadership Committee, the National Health Outreach Conference, which this year will be in May in Utah. And the question I'm sort of framing is, how do we build these mechanisms out even further than they already are to enhance the reach of my role to our extension educators across LGUs and to make the communication a bidirectional value add? You can hit the next slide.
I'm trying.
Yeah,
It's not
all
going.
good. So as we review, I think we went.
Too far.
Yeah,
Sorry, not sure why this is.
there we go. Weathering the storm is where we want to land. There we go.
All
Perfect.
right,
Thank you.
sorry.
All
Not
good.
sure why
All
this
good.
be problematic.
It's all good. It's all good.
Just one
So,
button.
so as we're doing those things, those revisiting the national framework and exploring and revisiting all of our communication mechanisms, it's important for me in all of these venues that I come to speak on to acknowledge that we're all weathering, and we can frame it many different ways, weathering storms or seeking opportunities, but it would be um, it, it must be acknowledged that we are navigating a very unique time. We've just recently had some of the biggest loss of both funding and of human capital and talent and educators in our system in our 112 plus year existence. And we need to work together to identify what comes next. And while the success of the Robert Wood Johnson Foundation capacity building project that funded my predecessor Roger and Carrie Gabbard out of West Virginia was great and strengthened internal and external partnerships, we are also navigating this unique and interesting time, which is again another reason why revisiting the framework now just makes absolute sense. Because even some of the language that we use needs to be thoughtful, and we need to be mindful of how the use of the language we use can impact us both negatively and not, or so positively and not so positively. So we don't know what federal funding is going to look like in the next few years. We don't know what the next iteration of community nutrition education is going to be exactly. And I'll talk a little bit about how we're working in that area in a moment, in a later slide. And the way that our system functions at the national level is uncertain, and we're all kind of riding this wave of gray and uncertainty together. So we must stay ready and nimble to opportunities that may present themselves during these times, while also acknowledging and recognizing all that is happening as well. You can hit the next slide.
There we go.
So where do we go from here? The cooperative extension, my sort of vision in this role is that we must continue to position ourselves both nationally and at the state level and at the community level as an explicit and vital partner in the public health ecosystem. So we do have that unique value add, both our history of being the trusted partner of reliable information, and also, our connections to communities. And so our community engagement efforts, coupled with that direct access to university research and expertise, is the way that we can continue to stand out as both an explicit partner, but also a unique partner in the public health ecosystem. So we need to work with extension systems to stay engaged and further enhance presence in all three of those areas of local, county, and state, and further our connectedness with each other so that we're hearing about things from each other. We're building our capacity with each other, both in the venues that have existed for years, like the National Health Outreach Conference, but also finding those opportunities in between the conference and in between the Health Leadership Committee meetings, so that we are really this seamless communication stream, and we're all sharing and learning and growing together and cohesively. Next. So a little bit more. There didn't mean to be the cross through the revisiting the upgrade. That's just a formatting error. We will be revisiting and updating the 2021 framework.
Right.
And we actually just, as I mentioned, I reached out to the institutional contacts, and we have a steering committee that just met last week for the first time. We received some guidance from ECOP. So with some lessons learned from the 2021 process that we are in the process of sort of thinking about, but the process for revisiting has begun and the steering committee has kicked off. And at this point, the steering committee, at our next meeting, we're going to review the 2021 framework. We're going to talk a little bit about the process because there's been some feedback, both excellent and areas for growth from the way the process went in 2021. Gives us opportunities to learn. So we'll reflect on the 2021 process. We'll identify what players aren't already at the table that maybe should be. We have great representation from across program areas, across LGUs. One of the ECOP uh, pieces of guidance was that we ensure that we are engaging the 1865s, 1890s, and 1994s. We're representing, have the good representation across all of the regions of the country as well as program areas within extension. So that's where we are in terms of right now. We have not yet set a goal for when we plan for the next iteration of the framework to be complete. We also don't even have a name for it yet because again, as I said a moment ago, we're recognizing the importance of language at this moment and being thoughtful that it's going to be up to the steering committee to decide what this next iteration is called and looks like. We'll be expanding upon those communication mechanisms. The institutional contacts just started meeting quarterly, so we're going to be having quarterly meetings moving forward. Those quarterly meetings have a different topic that we center the meetings around, but mostly we just want the opportunity for the institutional contacts to know each other, have the opportunity to ask questions to me, and for me to have an opportunity to get in front of folks and be able to have that dialogue and continue that bi-directional communication. We're also exploring how my role can provide capacity building and technical assistance to extension systems seeking to build a stronger and/or broader public health presence. As I mentioned a minute ago, totally understand and recognize that all of us are in different places as far as LGUs. Some have been doing different types outside of our traditional program areas, different types of community and public health work for much longer than others. And that's totally fine. And a lot of it has to do with internal and external environments that we're all navigating, and we're all familiar with that reality. That being said, it's important for this role that I am now in to be a source of support that can be very individualized if need be, and where I could be pulled into conversations and provide capacity building and technical assistance where needed and where requested. So that's something that we're exploring for this role over the next year plus. And then again, and I tend to repeat myself, but want to make sure there's that consistency of emphasizing opportunities and strategies for broader prevention and education programs like diabetes prevention, like behavioral health work, and different areas like that for those states of yours that are in the midst of an 1115 waiver or Medicaid redesign, opportunities such as that. Some of us are starting to bill Medicaid for the first time, and we need to be welcoming and really thoughtful of how to utilize and leverage those opportunities. So, lastly, in terms of where do we go from here, and I will be opening it up for any questions that any of you have for me about anything I present or anything else. But we also have two work groups that my role in support and leadership of the Health Leadership Committee. Um, we used to have different work groups that actually had funding tied to them. Neither of these two work groups well, actually, there's a little bit of carryover funds for the community nutrition education work group. So we have these two work groups that we've kicked off since I've come into the role, which I came into the role about May. And the community nutrition education post SNAP Ed, many of you may be familiar with what's called the SNAP Ed PDT. And that was the sort of group nationally of SNAP Ed educators that coordinated efforts together. Once the SNAP Ed funding ended, the ECOP actually encouraged the Health Leadership Committee, which I support and lead, and the SNAP Ed PDT to come together to figure out how we collaborate and move forward. And those conversations led to what has essentially become a merge of the SNAP Ed PDT now becoming a community nutrition education work group of the Health Leadership Committee. And that's a group of about 12 to 17 people. And their executive committee has joined as members of the Health Leadership Committee until the end of 2026, beginning of 2027, where we will revisit um, how this collaboration has worked and what the needs are and where we go from here. And the second work group that we have established from the Health Leadership Committee since me coming into the role is identifying how extension can best align with the Make America Healthy Again strategy. As many of you know, it's our understanding that there's going to be a fair amount of funding that will support the MAHA strategy. And again, the opportunities that we are trying to identify through this new environment that we're in is how do we create language shared language for all of us to use to align the areas within the MAHA strategy that do align with extension, and how do we position ourselves to survive and thrive and find opportunities and funding through that MAHA strategy. So those are the two work groups that the Health Leadership Committee has created and that I'm supporting in my role. And again, the plan with the MAHA group is to create a tool, a short, like one-page tool that we're going to release to the system that basically provides some of that shared language from the MAHA strategy with the mission and approach of extension and areas where they align. So the question sort of is, well, what will this look like in a couple of years, in 2027? Our plan is that the roadmap will be updated, that the framework to reflect the ever-changing environment to both extension and the broader public health landscape. We will continue to expand our broader public health prevention and education programming within cooperative extension, and continue to leverage partnerships, continue to build external partnerships so that cooperative extension really becomes known as one of those key players in the public health ecosystem at every level. And that there will be enhanced connectedness to extension educators across the LGUs, specifically in the area of community and public health. And that I will work with Health Leadership Committee and Extension Foundation and ECOP to find sustainability for the role that I've come into through creativity, partnership, and strategy, because it's my belief that there's enough amazing, exciting work happening in this area across the system that we should be investing in it it requires leadership to continue to bring us to the next chapter. So that is where that's where my head has been at since I've come into the role. It's been an incredible few months, and I'm looking forward to working with all of you and bringing together the opportunities of the coming day and updating the framework and seeing where the future takes us in an exciting way. So I'm happy to answer any questions you all have. It looks like I see one question in the chat. How do we envision USDA NIFA working with the Department of Health and Human Services as much of what we do in extension was called out in MAHA report? Does HHS, larger organization, know NIFA does this work? That's a good question. And I don't have the answer to that, but what I will say is that's exactly what we're trying to highlight, is that much of what we do in extension was called out in the MAHA report, and we're going to draw those connections and connect the dots and create some language that we can all be using to articulate that connection very well, so that when the funding that is aligned or that is behind MAHA starts flowing, that we are all positioned and ready to articulate how well extension aligns with some of those areas. But as far as understanding whether or not HHS and NIFA talk to each other or understand, I'm with an extension and I'm not within the federal government. I'm not totally able to answer how communications work within the government at the moment.
Are there other questions for Adam? This is a great opportunity to have a chance to speak directly, and you're welcome to open your microphone and do that, or to put them in chat. So we want to make sure you get a chance to see this broad overview that Adam has presented and bring everyone on board to understanding the role and position and work he's leading for the organization. Not seeing any others come in. I don't think I've missed them. So I think Adam, you're able to stay on board for the call, and you can continue to put items in chat as they come up and as you think about them, and we'll move forward, but you know where your contact is and where you can make those connections. At this point, we want to talk about one part of all of this programming, and that's Excite. And we just want to share with you as we bring closure to the first 4 years of work with Excite and where we've been, briefly about that, but more so where we're going next with interagency agreement and what that looks like. And I'm happy to have sharing with me in this effort Ruth Hirschman, and Ruth is a member of the Excite team, and she serves in the role as a regional coordinator, working directly with those of you in the states and the programs and the new health agents that we have hired. So Ruth and I together will be sharing some information about Excite, and I know there's other Excite team members on the call that can jump in and help answer as well. And I'll fight my way through advancing the slides. It's working 2 different ways depending, so I'll just get through that. But just as an overview, the overarching goals for the Excite program, which is the extension collaboration on immunization, teaching, and engagement, focus on immunization. The overarching 4 goals have remained the same and do continue to remain the same as we move forward. It's about increasing vaccine confidence, particularly in rural and medically underserved communities, increasing accessibility of vaccine clinics and vaccine opportunities to our priority population, increasing these connections and communications with priority populations and our healthcare systems and those who we can partner with who can accomplish this work. And also helping both our federal and local partners to implement public health efforts to help reduce health disparities. So overall, a major focus, it is largely on adult immunization focused, but we do have some of this information that we share with our adults about childhood immunizations as needed and as their interest. But our focus is on adult immunizations. And while it was COVID in the very first year, it has really broadened to all adult vaccines in all of the years after that initial year of COVID. Just a little bit about our funding. We did have had multiple levels of funding and from CDC, from the adult vaccine unit. And back in 2021 to 2023, we were dealing largely with COVID there and just getting information out so people could make informed decisions and to deal with misinformation, a huge amount. And you can all, it's almost hard to remember how that was, and yet it really is so recent. And we had a number of different projects in both awareness and pilot projects, and we were all learning a great deal at that time about health communications and how we could make a difference in our communities working at that local level. And Excite has really been a program that's at the national level with national impact, but very much directed at the local level and local communities and what's going on. We had some additional funding added on that led us to another phase that was an implementation phase of projects at $100,000 at many of our land grant institutions. Some of those were partnerships with institutions working together. And we really brought on board in a big way Washington State University College of Health Communications, who was very instrumental in helping us through some neurotesting, which helped measure how successful we were in delivering our message and helped us adjust our messaging that we might be more successful in that, as well as putting together a major toolkit around motivational interviewing and moving that from a clinical process of just a clinician and one-on-one to how we can use that strategy in group settings and be successful with motivational interviewing in groups. And we have a great handbook on getting to the heart and mind of the matter when we talk about resources that's available to everyone. And that's a technique we can be using in any of our health programs as a great way to communicate. We had in 2025, we had a very unusual funding. It was $6 million in 1 year that was to focus on bridge communication. So it's a huge amount of money in 1 year that was focused on the bridge program. And this bridge program was vaccines that were no longer being provided by the government, but was for those who were uninsured or had limited insurance to get COVID shots. We got that all set and put in place, and about 3 months into it, we had the situation where the government stopped funding that bridge program, and fortunately, we were able to keep the funds and able to redirect those to all immunization education efforts. And so we broadened that out and did a number of different things, but the key highlight from that is we focused energies on moving forward and developing integration projects that integrated immunization education into our existing ongoing extension programs. And we're going to be talking about that because that's really where we're going. This is just a quick look at the many institutions that have been involved in Excite over time. This is available in our annual reports. It's on our webpage, but just gives you a nice view of the great buy-in that we've had as a system to do this work around immunization education. And we're thankful that we've had almost 80 institutions that have been involved in this in various ways. And just a little bit about our numbers. In the 4 years, we reached over 51 million people. We had over 194,000 different engagement activities. These are individual activities that happened across the country. We held over 1,000 clinics in connection with the educational efforts that we were having. And we had over 52,000 people that were immunized at clinics that we had along with our immunization efforts. So that's Excite by the numbers. But as you know, it's not just all about the numbers. Here's an impact story that's more state level. This was North Carolina State University and their work. They targeted their work specifically at some of their migrant laborers and agricultural workers who had different requirements about coming into this country and working and immunizations and what could be done. And so they were really concerned about that audience. And you can see that they've had over 99% of the workers that they work with, often in the field, on the farms. They knew more about vaccines and felt they were both safe and necessary after the training, that we really increased confidence. And the Promotora program, which was really about a mentor, someone who's common to the community, as a volunteer, worked with over 371 individuals about that and helped spread that word. So an example of how this then impacted, we had the national data that I just shared, and then here's an example of state data. And then there's the individual level, which sometimes really shares the impact. And this, I'm not going to read this whole story, but it's really about someone recalling the anxiety and the concern they had about not feeling safe being out in the public, because they just weren't sure during this COVID time and the COVID vaccine, and go on to tell the story about the need for that and being able to get the vaccine and how that changed their life. And that, as they said, getting vaccinated was a turning point, not just for my health, but for my mental health. And so I just shared that the Excite program has had national impact in terms of the numbers and what we've done as a system, state level impact, and it has impacted people on an individual level. And we have lots of stories to document the impact of this work. And it is the result of all of your efforts that we've been able to continue Excite. And we did receive in September of 2024 what is a new interagency agreement, to which we really want to speak to you about now and where we're going. And this is $9.7 million that is taking a different direction. In the past, we were about awareness and about projects and individual projects in states and local communities. But we have pulled this money together around what people told us was really needed, and that was people to do the work. Even when we had funded projects, people had to do many different things, had many different responsibilities, and immunization education had limited opportunity for people's time and energy. And so what we heard was we needed people who could focus on this, and this was their job. And so we designed and were funded for to hire 20 health immunization agents for 3 years. We spent the year in 2024 working with the executive directors in each region and a team of folks they pulled together to discern and determine where the agents would be placed in their region. And many of those were hired this summer, and we have all but about 4 individuals who are hired and in place and have started this work. And we had a wonderful kickoff session with many of them in person in 2 weeks ago in Atlanta, where we met, and several of them are on the call and with us today. And if I just could have, I see some of them in my frame and others I can't see, but those of you who are serving as immunization educators, would you just, in these roles, would you just specially sign in right now in the chat and indicate that you are one of those individuals and people, and in what region you are serving, and then people will get to know some of you who are serving in those roles. So this is the plan that we set out to have accomplished, and each region received at least three positions for full-time positions of an immunization educator, and they could choose to hire a 4th position for an educator, or use those funds in some other way to support individuals who could do that. And our examples that are with that is 2 of the regions are using that 4th position to involve the FNEP program in immunization education and buying out time of FNEP educators to serve as part of this program in their 4th position. So each region has a plan, has designated where their agents are to be established, and has hired them. They are members of the individual institutions, but serving in this national program. And I think you've gotten a chance to meet some of those through this chat box here in the last few minutes. So this is the locations of our health educators and where they are. We are pretty well spread out across the country, including from Hawaii to as far east as Vermont and Connecticut. We do have one change to our map. We're going to not have a position in New York, but we will have 2 that are based in West Virginia in the Northeast region due to some university issues there. But this is where they are. And I'm going to turn it over now. Ruth, sorry, my slides are getting away from me, but I'm going to turn it over to Ruth, who's our regional coordinator, and she's going to share with you what these positions are, their roles and responsibilities, and talk a little bit about how you can engage with our health educators and have an opportunity. We do hope that every state will continue to do immunization education with more than just our 20 educators, and they do have some regional focus. So we're hoping our work will continue with everyone who's been involved with these folks providing some leadership and priorities. So Ruth, I'm going to turn it over to you to explain how this goes, and I'll try and move the slides.
Sounds good. Thank you, Michelle. Yeah, so as these positions came together, the job description was created so that everybody's job description is identical. And you'll see here on the slide that 50% of the time for these health agents is actually providing immunization education in the geographical area designed by their region. So we'll be talking in a couple minutes about the curriculum that was developed as an earlier iteration of Excite, but the intent is that each of these health agents will take at least one of these curriculum and be able to spread that curriculum in their area, in their region. Next slide, Michelle. And so with half of their time being spent on the immunization education, they also will have 25% of their time being spent on providing leadership and professional development to the extension professionals in their region. So that might be incorporating immunization education into existing work that's going on in their area. So how can they help their extension professionals in their region to be educated about vaccines or to be comfortable talking about them, and how can they help them incorporate those vaccine messages? And you'll see with some of the curriculums that have been developed, some of them are standalone curriculums and some of them are supplemental materials that are intended to be worked into programming and that's already happening out there by a lot of the extension professionals already. 10% of their time will be spent on developing and maintaining immunization partnerships in the community, regional or state levels. And these are coalition meetings and networking and relationship building with the healthcare professionals in their areas. And then lastly, 15% of their time is on personal professional development, scholarship, program evaluation, and reporting. Next slide. This is just kind of a screen capture, and it's hard to read, I understand that, but we created a curriculum catalog so that all of the curriculum that have been developed, and there's 11 curriculum that we have identified and were created as part of Excite. They're all in a catalog. I'll show you where it's located on our website in a second here, but this is an overview page that's at the beginning of this catalog that will tell you what the curriculum is, kind of what the format for incorporation is, how many sessions, who the audience was intended to be, the methods for delivery, training, and then there's evaluation within each of these curriculum. So we'll go ahead and move to the next slide and showcase it in a different manner. So on the next slide, it's going to show you the link to our website. It is excite.extension.org. This website has been completely redone. And so if you haven't been there recently, I encourage you to go there. In the very center of this website opening page, you'll see that it has a link that says Getting Started in Vaccine Education. You're going to find some online modules that were created by Excite teams in the past. These are great starting points for people that want to get some foundational level information about immunizations. And each of those modules, there's I believe 3 that are up there currently. There's a 4th curricula that's coming on board there, and they're all intended for different audiences because we realize that not everybody's like not every curricula is going to make sense for every individual. So there'll be some online materials there that are great curriculum. The second tab there is resources and materials that have been created by Excite teams in the past. All of these materials have been vetted and gone through some neuromarket assessment just to make sure that they're all valuable and ready to go. They can all be utilized in any format. Just drop a logo on them. They're created to be utilized. So we encourage you to go there, explore those resources, and if there's a way to share those more broadly, please do so. And then you'll see again the link to the Excite curriculum catalog. That's the one that I just showed you a minute ago. You can get the whole catalog in its entirety at that link, that last link there. The other thing that I'm going to call your attention to is this little hamburger up in the right-hand corner. If your screen is wider than mine, it will actually show you all the curriculums there. And so it's an easy place to go and be able to just open up a curriculum and see what's involved in that curriculum. You can move to the next slide, Michelle. oops, there we go. Perfect. Thank you. And so here you can see the 11 curriculums. So on our opening Excite webpage, as you scroll down a little bit, these curriculums are all listed. If you hit the little plus mark, they will open up and tell you more information about them. So you have an understanding that the Balanced Living with Diabetes is a supplemental immunization supplement that would be incorporated into those curriculums. If somebody's already teaching Balanced Living with Diabetes, it's an easy add-on to add in the immunization supplement. And again, some of these are standalone materials. So I encourage you to go there, take a peek. You're able to actually see the materials, the facilitator guides, the evaluations, the materials that would be incorporated. All of that's available on the website. And it's being built out more and more every single day, thanks to Melanie and people like her. The other direction, please. There you go. One of the curriculum I wanted to highlight very, very briefly is our poverty-informed strategies for immunization education. Lindsay McConnell-Song, who is on with us today, is one of our health agents, and she developed this curriculum based on some materials from Dr. Beagle and her work on poverty-informed care. And so Lindsay recognized the importance of having an approach that's effective for people that are living in poverty and how best to approach this with them. Oftentimes people aren't necessarily vaccine hesitant, they just have a lot of barriers and things happening in their world that make it challenging for them to be able to get immunizations or other health concerns taken care of. And so this training is a standalone curriculum, and it starts out with an online portion. We've kind of just been doing some brainstorming about how best to approach this curriculum, and what we've decided is we're going to do 2 online sessions. These sessions are open to all of you, all of the extension professionals out there that are interested in getting the foundations of poverty-informed strategies. You would take one of the session 1s and one of the session 2s to get that 6 hours, they're 3 hours apiece. So you'd end up with that 6 hours of training that would really, I think, help everybody in the work that they're doing with the individuals that they're interacting with every day. For those that are wanting to actually implement the curriculum with others, there would be an in-person training that we're going to be providing some places and dates in the future about where those will be. Just also of note, there will be a registration for these sessions coming out in the very near future. But we do need to cap the attendance at these sessions just to make sure that we can have a good conversation and not have it be overwhelming. We want to be able to have some conversation as we work through the materials that Lindsay has put together for this. You can move to the next slide. And then lastly, I wanted to just bring to your attention the professional development that we do every month or every quarter. These have been ongoing for the last few years, and it's something that we've done to help support our Excite teams, but they are open to all of the current and past Excite teams. They're open to anybody that works in the world of immunizations or vaccines, anybody that has an interest in immunization and vaccines. You can hear all about the great work that's happening with the Excite teams, as well as we always have some wonderful educational components as a part of it. They run on the 3rd Thursday of every month. They're from 3 o'clock to 4:30 Eastern time. The registration for this is on our webpage, on our opening screen. If you scroll down towards the bottom, you'll find that registration link. So I encourage you to attend these as well. The next one, as I said, will be held on Thursday, December 18th, but they run quarterly. And that's the material I had to share, Michelle. I'll turn it back over to you.
Great. So I'll just add to Ruth's comments that our 20 agents that are going to be around in the country and in our regions, they will be connecting with each of the states, and they're working through what that process will be to collect all the immunization education work that's being done outside of the states where they are, but within the region. And so as you begin this work, we really need to develop a way, and whether that's through the health contact that Adam has in each state, or the regions will each be working through this, but we hope to be able to collect nationally and talk about the immunization education work that's done not only by our 20 agents, but also by those around them. And as you can tell from the job description, a major function of the position, 25% of the position, is training all the staff. If you're currently doing diabetes education, there's two different programs where you can integrate vaccine education into diabetes education. If you're currently doing a program that's about how to talk to your doctor, we now have the talking points about how to integrate immunization education in there in these national curriculums. So we're really, and each of the other curriculums are all going to be available to the region to be able, particularly looking at things we already have going and how you can now integrate, as we see this as really as the way to move forward. People aren't excited to come out to an immunization education program alone, but when you're talking about health and integrating this as part of a whole health focus, which is really where what Adam described in terms of looking at the whole individual and whole health across the lifespan, integrating this immunization education into all of those opportunities. And these curriculum provide the talking points and major ways, PowerPoints, resources, slides and talking points to do that. So it's a way for all of you to be involved, and the materials have been produced and can be integrated into your efforts as Ruth was describing. So we're very excited. This is a 3-year funded program in terms of Excite and where we're going next. We are hoping that we'll develop some additional programming, national curriculum as we move forward. We have hopes of working in the area of some maternal health that we're, if we get some additional personnel time to help us to provide leadership for that. We hope to have Adam be involved in bringing all the diabetes educators together and talking about how to integrate this across the country. And so we really are looking forward about the integration and the opportunity to use this in many ways and in things that we're already doing. So at this point, we have just a few minutes left, and we want to entertain any questions that you have at this point that we could respond. I can say the total funding that this brings us up to is $33 million of investment that CDC has made into cooperative extension as a system over this course of time to do this work. And most all of that, the hugest percent of that has gone out to individual institutions and now into these positions. Out of that 9 million, almost 8 million of that is going directly out into these positions for 3 years worth of work. So we're really trying to move this to the institutions to support the work that we're doing in health across the country. What questions do you have at this point that we might be able to respond to regarding where we are with immunization education and this new approach? Feel free to open your internet to microphone to ask questions, or just to type them in chat. I think you can see in the chat some of the individuals on the call who are members of this new cohorts, and they're all working together as well. And they will be in touch with you within the region. Some of them are new to Extension, some of them are not, but we'll hope you'll get to know those who are in your region, and that your region will perhaps collectively be focused on 1 or 2 of these curriculum to start with as we begin the new year, that we can begin programming with this integration early in the new year. Any questions? Not, Melanie, I'll turn things back over to you as Program Center Stage extraordinaire manager of the whole Program Center Stage, and turn it back over to you at this point.
Sure. Thanks, Michelle, Ruth, and Adam, for all that great information. As I said at the beginning, I will be sending out all the links that were shared, including the website and links to the curriculum page and the recording and slides, so everyone can be referencing that and hopefully, be in contact and communication with their regional health agent. I also just put in the chat a web page that Excite supports, which is the H5N1 work. So that has a lot of different resources and information about things like social media posts and resources that just like Excite has, but supporting H5N1 work. So I just wanted to mention that. I'll give maybe one more minute if any questions or comments or insights came up. But if not, it looks like people are starting to hop off, so we can go ahead and wrap up. Thanks so much for joining us today. And I hope you have a great rest of your Monday and a great rest of your week. And again, this is the last program center stage of the year. So thanks so much for joining and for joining all year. It's also always so great to see our colleagues from across the system. Bye, everyone.